In the world itself, just few couple of cases have been reported. Full form PAWA is primary abdominal wall abscess. Sir, as Lokanath sir just mentioned, in 9 years of service, this was the first and could be the last case which he has seen in ashram. Fine. See how the PAWA. Let's see the case. There is no extension to the lower abdominal organs. No history of trauma. No history of infection. There is no history of immunosuppressive drug. Where did it come? It's not a magic. It has to come from somewhere. Just not a black magic, somebody's skin. So, the answer is very simple, sir. There is occult infection somewhere in the body, which you have not located. Would you like to comment, sir, on that, sir? Or else, whereas or still there, as sir says, when nothing is there, there is an autoimmune because of stress, yes, or something, which is not beyond explanation. Would you like to comment on that, sir? From nowhere, anything can't come, sir. There has to be some source of infection where you are giving draining, you are giving antibiotic, you are giving IND. From where is it coming? You have got infection somewhere in the body which has not been detected. Your answer.
It is true. What Sarah said is true. But I thought wrongly because the patient is not giving any history of trauma. But I thought there may be a trivial trauma which has not caused any inconvenience or complaint to the patient. That might have got infected. Second. Because muscular
but 2 days. 2 days before he is normal. And how much that much of pus collection? How it is possible, sir? I think there may be intestinal tuberculosis.
there is no history of any of the diseases. There is no history of trauma. There is no history of any other disease. That is also non-specific. Because the patient
What is the age, sir? What is the age,
yes,
sir?
sir.
Some beginning of ileum.
That is only that slide. Yes, sir.
To rule out any chronic infection. Rule out any chronic
So
infection.
in the body, everybody might be having some unnoticed chronic infection, especially in the oral cavity or in the somewhere in the skin. There, unnoticed infections, chronic, they will not cause any infection to the patient. But they may do disease problems like this. And the common cause, as far as my knowledge is concerned, but the is trauma. Unnoticed trauma. See, even strenuous exercise also, there will be care to the small vessels and they may cause secondary infected. So that is the only that has come to my mind. But in the literature, they have mentioned intra-abdominal diseases may also come to the anti-abdominal. That's what I mean. It's not, but in the primary, in PAWA itself, he has mentioned so many things like intra-abdominal ileal perforation, presenting as intra. No, but the first time is that's right. So he came in the complaint is here. Later he developed his own. Because the patient is not having cough, not having. There is no other complaint. It is showing so many things. I always got the ultrasound is showing general fascia and all. So the patient is not having any other complaint except huh? So even if it is ileal tuberculosis, how it comes to the anti-abdominal one? How it comes to the anti-abdominal one? The ileal tuberculosis can render so many things in the intraperitoneal. No, that must be the different. That must be the different patient. Yeah, I think the patient has responded to the routine antibiotics. No, that's what I'm telling. Unnoticed unknown infections. From secondary foci will be there. For example, I'm having listen. That's what I'm saying. So, that's what but he did not mention that I have a friend here. That's what. That is the thing. Yes.
Discuss the different aspects of this. Of course, this is a very rare case, and it was a good presentation, Akash. So, sir saw this case in his 9 years of experience. I don't think you can say your 20 years, but sir told that you very, very correct. Whenever you are getting this kind of case, 99 point, not 99, 100% of the time you think that this is secondary abscess. Because secondary abscess means not, so I am not contradicting, such as I am giving different discussions. So most of the time this is secondary, and as sir told, there can be some minor trivial trauma will be there that is missed, like say abdominal trauma that produces paniculitis, fat cell necrosis, and automatically it will move into an abscess. Then another possibility, like madam told, some minor prick, some sea animals or something, whatever, that may go unnoticed. Okay. Third thing, I will tell the most important possibility in this case, but that I will speak last. Third may be some fungal infection also. Okay, some fungal infection, but that also requires some trauma. Sometimes first won't be there, and of course there will be blood will be there, and that's why the main DD I will tell, that is tuberculosis. In this case, definitely tuberculosis is the possibility, because you see there is ileal thickening, there is bilateral lung atelectasis, and personally I have seen one case, sir. I would share that experience. Same kind of abscess, without anything, no clue, nothing, no tuberculosis in the lungs, nowhere. But the only clue was there was some sinuses, some indrawing sinuses were there in the abdomen. So any abscess with this kind of sinuses, definitely tuberculosis is a possibility. I kept that patient for 1 year ATT, and that patient recovered 1 year, not 6 months. So any possibility in mind of okay. Of course, whenever you are getting this kind of case, you have to rule out some secondary cause, because sometimes folliculitis, unnoticed folliculitis also that can see culture sensitivity, and most of the time, even if it is tuberculosis, you can grow all these organisms, because it is some secondary infections will be there, and your treatment is absolutely correct. And the main thing for your diagnosis, supporting your diagnosis, is without giving any other treatment, only with antibiotics it responded. So probably this is SAWA, but most of the time, probably it is PAWA, but most of the time it can be SAWA. And in my experience, it was TAWA, tubercular abdominal. Thank you.
Thank you, Siddheswari ma'am. Thank you, Mr. Welcome.
The patient is having sinuses like that. So, if the patient is having any sinuses like that, definitely we have to get suspicion, and we have taken biopsy from them. The patient has come with just swelling, with erythema, fullness, severe tender, with mild fever, no other complaint, no other question. Which has, see, we have been observing, we have submitted the patient for investigation. It has thickened, that swelling, that pus has taken into scrotum also. So afterwards, because it has come to the scrotum. So, tuberculosis అనేది we have not given any antitubercular treatment, we have not given any other treatment. Yes. But that's what I am telling. So that is minor disease. That also considered trauma.
Because of heart related. That is because that fishermen are small these things they won't upset. They won't take it serious. Mostly that may be they 1 month back, 2 months back he had five injuries that have precipitated that was presented. But everything is not 2 days. That is not correct. Within some to us within 2 days, but it is indefinitely some for formation of the birth itself you take the stages are there. You take minimum 1 week. Small body become birth and everything will let them sometimes. But here everything 2 days that is not correctable. But there may be minor injuries which leads to
Okay, not noticed by the
not is not noticed that is like this.
But the common injury to the abdominal wall is muscular strain and tear of the vessels. Even the
Anyway,
tear of the vessels, because of the straining, because of the patient
where are the presence very large cast that's my
that cause is no. That is infected. That is common cause for abdominal rectal sheath, blood vessels.